Inside the voice box or larynx, we all have vocal cords. The normal movement of the vocal cords are necessary for voice production. The vocal cord, it's not of single layer. It's in three layers: epithelium, middle lamina propria, then you have the body. So only if I tell you about the structure of the vocal cord, little more in detail with the picture, you will understand what I mean by vocal sulcus and why we treat like this. So let us see that first. These are the vocal cords, and if you take a cross section of this, it's going to be like this. Like how I have mentioned before, this is the outermost layer, epithelium, then you have the lamina propria, then you have the body. This lamina propria, again it can be divided into superficial layer, intermediate layer and deep layer. In this condition, vocal sulcus, what happens is, the patient has got a habit of voice misuse, and he talks in a very loud voice, and he doesn't give rest to the voice also. So when the damage starts, it starts with the epithelium, and the patient doesn't give rest, so the damage extends to the next layer, and it goes on like that. So what happens is, because of the poor healing also, you have a sulcus in the vocal cord. So this can be affecting one vocal cord, or it can be on either side. So the cause for this I have already mentioned. It is because of the phonotrauma, or he misuses the voice and doesn't give time for healing, and there is poor healing too. We have three types in this. I am not going into the medical details of that. The main cause for this vocal sulcus I have already mentioned, and the commonest complaint of the patient will be that he is not able to raise his voice like before, and there is change of voice. So we'll go ahead and do an endoscopy, flexible endoscopy, which hardly takes 5 or 10 minutes, 5 minutes, and it is done in the endoscopy room, and we don't have a special preparation for this. And when we do an endoscopy, as we see in the right side picture, the vocal sulcus can be clearly seen. We need to go ahead and do stroboscopy and voice analysis. Most of the phonosurgeons, they'll ask for it. Now, coming to treatment. The main cause for this is voice misuse, voice abuse, phonotrauma. So he has to give rest to his voice and avoid voice abuse. At the same time, we'll give anti-acid reflux medications too. The main treatment for this is going to be surgery. Here, like how I mentioned before, the vocal cords during phonation, its adducts means comes together, then it abducts means it gives way. So the normal adduction and abduction movement helps in voice production. In a case of vocal sulcus, during adduction, it does not adduct it adducts, but it does not close the gap completely, because there is loss of tissue here. So the voice quality is different, and there is hoarse voice also. So we need to fill up this gap, the damaged area. This we can do by intracaudal injection of any of the three materials, like it can be fat or hyaluronic acid or the commonly used Teflon. That is one technique. Second one is, this ragged edges can be removed and sutured, so that we can help them in healing. Third technique is, the idea is to bring the vocal cords nearer so that there is no gap. So we can medialize the cord, and we call it a type of thyroplasty, which is called as medialization thyroplasty, which is a separate topic by itself. And if you want to go through this topic, you go to my other video. So under the name medialization thyroplasty, then you will understand. So the surgery related to vocal sulcus are any one of these four. So it approximately takes less than an hour, other than the medialization thyroplasty. So once the surgery is done, maybe you will be asked to stay in the hospital for a day more, and the second day you will be discharged with the advice of voice rest for 1 week, and to meet the speech language therapist on the second week. So during discharge, you will be prescribed painkillers for 2 days, mild painkillers for 2 days, and anti-reflex medication, proton pump inhibitors for a period of 3 weeks. Avoid smoking, and of course avoid voice misuse. Avoid whispering and throat clearing, please. And if you have cough, the treatment will be given for that. The best way to control throat clearing and cough, sip in warm water whenever you feel like throat clearing and cough. That will avoid throat clearing and cough. And not only that, you have to avoid hot, spicy food items and cold food items too. Avoid caffeine, coffee, chocolate, beverages, and beverages I have already mentioned, and chocolates too. So that will be your normal diet. The diets to be avoided, and you have to take a balanced diet. Drink plenty of water. So after surgery, it doesn't mean that you can shout again like before. Your voice can be near normal, it will be better. Near normal, it will not be normal, it will be near normal or better. So that's how we manage a case of vocal sulcus. Thank you so much.